Dr. Deleep Kumar, Professor and HOD of Government Medical College, Manjeri, for his talk on ischemic optic neuropathy. Over to Dr. Deleep.
Good afternoon. Today I am going to discuss about ischemic optic neuropathy, current concerns. Pathophysiology, this is a blood supply of optic nerve head, mainly affecting short posterior ciliary artery. There is circle of sin and all. And it is one of the causes for sudden reduction in blood supply that causes sudden loss of vision. A group of diseases characterize a sudden reduction in blood supply to optic nerve, causing an infarction. Common cause of it's a common cause of vision decrease. One of the commonest causes of a sudden onset decrease in vision is optic neuritis. Underlying diseases may be a result of this condition. Inflammation of the blood vessels may result from severe inflammation of blood vessels affecting the optic nerve circulation. Risk factors, there are ocular risk factors. Small disc is one of the causes. A small cup, optic disc drusen, chronic mechanical obstruction to exoplasmic flow, angle closure glaucoma, and after cataract extraction due to increased IOP. Risk factors, systemic hypertension is one of the causes, diabetes, ischemic heart disease, nocturnal hypotension, obstructive sleep apnea, severe anemia, and migraine. Pathogenesis. There is hypoperfusion of the optic nerve. There will be hypoperfusion of the prelaminar portion of the optic nerve head supplied by the short posterior ciliary nerve arteries. There is axonal edema is there. Axonal edema leads to death of ganglion cells of the optic nerve. There is a vascular disease. This vascular disease may impair the autoregulation of the optic nerve head blood flow. Clinical features of non-arteritic ION. There is a sudden onset of loss of vision. There will be reduced color vision, as already discussed by Rajini madam. There are field defects, there is attitudinal central field defects you can see, RAPD, optic disc features, there will be a sector of optic disc hyperemia and disc elevation also there, and disc edema, hemorrhages, there will be flame shaped hemorrhages you can get. Clinical course, IONDT, that is ischemic optic assessment decompression trial, summary of clinical findings and patient outcomes. Here the patient statistics, 250 patients with acute non-arteritic ION and visual acuity below 20/64. Visual acuity improvement at 6 months, visual acuity improved in up to 42.7%. There will be optic atrophy may be there. It sets in, it will optic atrophy will be appearing after 1 to 2 months. Okay, always there will be contralateral eye involvement maybe there. Here it is a 15% over a follow-up of 3 years. Clinical features will be headache, scalp tenderness, jaw claudication, intermittent episodes of transient blurring of vision, proximal muscle and joint aches, that is polymyalgia rheumatica, and sectoral disc edema is also there, chalky white color. Risk factors, medications like sildenafil, interferon alpha, interferon, amiodarone, etc. will cause these problems. medications. Diagnosing the gold standard negative biopsy does not rule out arteritis due to skip lesions. So you have to take long enough to get the diagnosis. Intimal thickening you can get internal limited lamina fragmentation, chronic inflammatory infiltrate with the giant cells also. Management of this non-arteritic ION is oral prednisolone 80 milligram for 2 weeks and gradually tapered and you will get improved visual acuity. Aspirin also you can give. Radial neurotomy relieves compartment syndrome. ESR and CRP levels will be increased. ESR is keynote. Here CRP is elevated. Here 97% specificity is there for ESR more than 47, CRP more than 2.45. Fluorescent angiography is other method of investigation. There will be disc and choroidal filling delay you can expect or see. Steroid sparing agents, agents like tocilizumab, monoclonal antibody, binds to alpha chain of the human interleukin 6 receptor. FDA approval get in 2017. It blocks signaling and down regulates the acute phase reactions. Abatacept, methotrexate, etc. Conclusion: non-arteritic ION is one of the commonest forms of optic neuropathy in the elderly. Arteritic ION is a medical emergency and must be treated with immediately with steroids. Mainstay treatment is steroids. Is steroids induction phase. Induction with 3 days with IV steroids. That is with prednisolone. Tapering phase, long and slow. Oral steroid taper you have to give. Thank you.
Thank you, sir, for that comprehensive talk on ischemic optic